Introduction of Persatuan WeCareJourney by Mr. Edmund Lim, followed by About SMA by Dr. Chengxu, Living with SMA from a Perspective of a Patient and a Caregiver by Madam Sutyi and Aina Farhana. And for this session, my dear friend, Ms. Sharus, will be taking over. Okay, next we have a Q&A session. And lastly, we have a Kahoot session. I will now introduce Mr. Edmund Lim, who is the co-founder of Persatuan WeCareJourney, together with his wife, Madam Sutyi, back in 2016. He is a father of two lovely boys, Jaden and Brandon. And for your information, Brandon is a type 1C SMA patient. All right, Edmund, the stage is yours.
Hello, everybody. Thanks, Azika. Good morning, and thank you for making the time to attend this webinar. It's such a privilege for myself and for our team at WeCareJourney to have everyone here today. In our WeCareJourney, we started in 2016. At the time, the standards of care in Malaysia for SMA were not well established because the awareness was actually quite poor. So we spent the early days trying to improve and raise the level of awareness, as well as provide the assistance that was required with the families with SMA. Now, over time, we're very blessed to have doctors start to get on board, to work with us, to see what they can do to help build a more supportive system for families with SMA. You will hear from one of them today, which is Dr. Chung. So she's one of the pioneers who actually came out and stepped up to really help us drive better standards of care so that we can have a much better quality of life. Today, we also have industry partners from the pharmaceutical industry. So we have Biogen, we have Roche, we also have Novartis, with us together in this journey to work together to see what we can do to help close the gaps around access to care and raise the standards that every family can expect to receive. This webinar is just the start of various other things that we're working on to try to build awareness. And I think it's from awareness that you start to have that knowledge that you can actually take action or just share information that at some point it's going to make a difference to someone who might have a child with SMA or as a patient themselves. Now, we've seen that happen many times in Persatuan WeCareJourney, that someone knows someone, shares the right information at the right time to allow that person to get the help that they need. Again, I don't want to take up too much time because there's just so much interesting stuff that's coming after me. So I'm going to pass it back to Dr. Hazika to go on to the next scheduled item. So thanks, Dr. Hazika, and thank you everyone for making the time to be here today.
Okay, that was a very inspiring story, Edmund. Thank you for the sharing. Now, without further ado, we will move on to our next agenda in list, which is about SMA. But before that, let's do some polls. Okay, so we have two poll questions here. Have you heard of SMA before? Is it a yes, first time hearing it today, heard of it but do not know in depth? And the second question is, what is your background? Either you are students, medical graduates, doctors, allied health, patients, caregiver, and also the publics. Okay. Hope you guys have enough time to answer the polls. I will end the poll in 5, 4, 3, 2, 1. All right. So many of you guys have heard of SMA before. Almost half of you guys. And yeah, we have majority of us today is students and also allied health. Yeah, so yeah, that's great. Okay. Okay, so the next session is very related to the polls. I hope you will gain as much as possible from this session. We will have Dr. Chengxu, who is a consultant clinical geneticist and pediatrician. She currently heads the Department of Genetics in Hospital Penang. Dr. Cheng formerly worked for 11 years in the Department of Genetics in Hospital Kuala Lumpur, which serves as the National Referral Center for Inherited Metabolic and Genetic Disorders in Malaysia, and she is also one of the Medical Board of Advisor in Persatuan WeCareJourney. Now, let's proceed with a clip about SMA, and if you have any questions, please type in the chat box and Dr. Chung will get to them later.
Spinal Muscular Atrophy, or SMA, is a genetic disorder where nerve cells in the spinal cord die prematurely. And this causes the muscles that would normally be controlled by those nerves to atrophy or wither away, which causes weakness. When the brain wants a muscle to contract, it sends a signal through an upper motor neuron, which takes the impulse from the brain to the spinal cord, and then through a lower motor neuron, which goes from the spinal cord to the neuromuscular junction, which is where the lower motor neuron touches the muscle cell. The lower motor neurons, which cause voluntary contractions of skeletal muscles, are called alpha motor neurons. And these alpha motor neurons are the ones that die in SMA. Their cell bodies are found in the anterior horn, or front part of the spinal cord, and their axons project from the spinal cord all the way to the muscles they innervate. A group of these neurons is called a motor nerve. If a lower motor neuron dies, or if the entire nerve is injured, the motor unit, which includes the neuron and the muscle fibers it innervates, stops working. Depending on how many muscle fibers stop contracting, there can be overall muscle weakness, or in an extreme situation, a flaccid or low-tone paralysis. This denervated muscle also atrophies over time, a classic example of use it or lose it. This contrasts with the increased muscle tone and spasticity that develops after an upper motor neuron's damaged. When a lot of these muscle fibers are affected, fasciculations can happen, which are spontaneous, involuntary muscle contractions. Alpha motor neurons also carry the signal for muscle contraction in deep tendon reflexes, like the knee-jerk reflex, and they diminish or disappear when alpha motor neurons are damaged. Now, it turns out that there are a few types and subtypes of SMA. Type 1A, congenital SMA, is the most severe of all, and it starts even before birth, when mothers might notice decreased fetal movements. SMA type 1B, also called infantile SMA or Wernicke-Hoffmann disease, is the classic form where babies often appear normal at birth and then in the first few weeks of life develop hypotonia or low muscle tone. These infants have progressive weakness, which is worse proximally than distally, and is initially more obvious in the legs, making it hard for them to do things like sit up. They can also have weakness in the muscles involved in sucking, chewing, and swallowing, and as a result they can have difficulty taking milk, eating foods, or even safely swallowing their own secretions, which can lead to aspiration. The weakness can also affect the chest wall muscles and diaphragm, leading to breathing difficulty and eventually respiratory failure. For these reasons, most of these babies survive only a few years. SMA types 2, 3, and 4 are each successively milder and have a later age of onset. In addition to muscle weakness, feeding problems, and breathing difficulties, chronic symptoms of SMA include scoliosis due to poor muscle support of the spine, and extremely thin limbs due to muscle wasting. The different types of SMA all result from the same homozygous deletion of the survival motor neuron 1 gene, or SMN1 gene, on chromosome 5, and this is inherited in an autosomal recessive pattern. The SMN protein from the SMN1 gene is expressed in all cells. For one, the SMN protein is a component of the spliceosome, a molecular machine that cuts the introns out of pre-messenger RNAs. SMN also blocks caspases, which are proteins involved in apoptosis, or programmed cell death. So lacking SMN might also enhance apoptosis. SMN protein's particularly important for alpha motor neurons, but the exact mechanism relating the protein to the function of those cells is still unclear. Now, the genetics help explain the continuum of severity that we see across SMA, and it has to do with the SMN2 gene, which is a pseudogene that sits next to SMN1 on chromosome 5. Pseudogenes are mutated copies of genes that arose during evolution, and are less functional or non-functional versions of their counterparts. SMN2 is more than 99% identical to SMN1, but has one important change in exon 7, called C840CT. And this means that while the 840th nucleotide is a C in SMN1, it's a T in SMN2. And this tiny mutation results in exon 7 being spliced out of the majority of SMN2 mRNA. Not having exon 7 means this SMN2 gene churns out SMN proteins that mostly get degraded, with only a couple full-length functional SMN proteins, relative to SMN1, which churns out only functional SMN proteins. Furthermore, often people might have multiple duplications of the SMN genes, which might result in several copies of SMN2, and this SMN2 copy number actually varies quite a bit in a population. Now, all this is important because patients with SMA have no functioning copies of SMN1. And since SMN2 still makes a small amount of functional SMN protein, the number of copies of SMN2 determines the severity of spinal muscular atrophy. More copies means more SMN protein, and a milder SMA phenotype. So, as an example, a patient with 2 SMN2 genes might have infantile SMA, whereas a patient with 4 SMN2 genes might have a milder subtype. Treatment for SMA has historically been supportive, like giving infants nutrition through a feeding tube, as well as respiratory support to help with muscle stiffness and strengthen respiratory muscles. A relatively new therapy for SMA is called nusinersen. Nusinersen is an antisense oligonucleotide that binds to the SMN2 pre-mRNA and prevents exon 7 from being removed, which allows the SMN2 mRNA to get expressed, ultimately making a more normal amount of SMN protein. Alright, as a quick recap, spinal muscular atrophy is an autosomal recessive disorder where a deletion of the SMN1 gene causes alpha motor neurons in the spinal cord to die, resulting in muscle weakness and atrophy, and in more severe cases, respiratory failure and death. Thanks for watching.
Okay, so I hope we all had a brief understanding of SMA after watching the video. Now let's ask a few questions to Dr. Chung based on her expertise and experience. So good day, Dr. Chung. Thank you very much for being here with us.
Thank you, Hazika.
Yeah.
Good morning, everyone.
Right. So Dr. Chung, in a nutshell, what is SMA?
All right. I hope you have learned something from the previous video clip. It's been actually a very good clip, and actually go through and revise it. So in a nutshell, spinal muscular atrophy, or SMA for short, is an autosomal recessive neurodegenerative condition where a deletion of the survival motor neuron 1, or SMN1 gene, is deleted and causing motor neurons in the spinal cord to die, which leads to progressive muscle weakness and atrophy, and in more severe cases, respiratory failure. Muscles controlling the movement of the arms and legs, speech and swallowing and breathing will progressively wither away, causing significant impairments in activities of daily living of a person affected with SMA.
All right. That was a very good explanation, Doctor. There will always be so much more to learn. Doctor, to diagnose SMA, what is the first line and the gold standard investigation needed?
To enable early diagnosis, first and foremost, we must be able to promptly recognize the neurological signs of SMA. So I think medical graduates, we have learned this in medical school. A faulty baby with developmental delay, and look out for signs of lower motor neuron lesions such as hypotonia, tongue fasciculation, and absent reflexes. The baby is usually very alert, and you can see this typical paradoxical breathing pattern. And sometimes the family history will do There is a need for SMA awareness and education among all levels of healthcare providers in view of recent advances in SMA management, such as the emergence of novel therapy. So medical students and graduates like yourself who come on board today to gain more knowledge, and especially so also for family doctors and GPs and the general pediatrician. The gold standard of investigation would be a molecular genetic testing, which is confirmatory. And we're looking for actually the gene dosage analysis, and basically we're looking at the SMN1 and 2.
Okay. All right, thank you, Doctor. So, Doctor, as a parent or a caregiver, what should they do if their child was diagnosed with SMA?
Well, we may put ourselves in their shoes to have to reflect this way. If I have a child with diagnosed with SMA or a loved one, perhaps a niece or a nephew, how would I feel? Am I able to cope with this diagnosis of a rare condition? What do I need to know? What type of support can help me cope? And how and from whom can I get help? So it actually depends on where the child has been diagnosed, either in a district hospital or in a tertiary center. It's important to ensure that the child is referred promptly to a center with available expertise, namely pediatric neurologists or geneticists, and sometimes it's just a phone call away to coordinate a multidisciplinary standard of care. So parents are encouraged to request for and seek emotional and mental health support if they are overcome with shock and grief on receiving a diagnosis of SMA and learning of the prognosis. This you can ask from the doctors or counselors, but what better way than from another family who has gone through similar experiences, right? So by connecting with SMA support groups such as WeCareJourney, parents will feel less alone and less helpless. And through this mutual sharing of information, they may feel more adequate to care for their child. So we must applaud the initiative from WeCareJourney. I think they're going to be launching an SMA care pack, which will empower parents and caregivers, and also primary team of doctors to navigate, these difficult care pathways for people who are not familiar.
Yeah, it must be very hard for them to face the news, but we are glad to have a clearer insight on this. Next question is regarding the genetic screening. We would like to know if the genetic screening for SMA is easily available in Malaysia, and how much does it cost?
Well, in Malaysia, we do not have the actual prevalence and burden of disease of SMA. But our local study in 2018 estimated a median incidence rate of 1 in 20,000, as compared to the worldwide 1 in 10,000 live births. The underestimation of contributed by delayed diagnosis and poor access to genetic testing and specialist care. Therefore, appropriate genetic screening for SMA in the right context is very much encouraged. And yes, it is very easily available locally. Genetic screening or testing needs to be accompanied by pre- and post-test genetic counseling. This is through Ministry of Health and University Hospitals in Malaysia, which provide clinical genetic service. Please do visit our Genetic Counseling Society Malaysia or GCSM website or Facebook page, which lists all the centers, the contact details of such centers in Malaysia. And in the Ministry of Health Hospital, like in Kuala Lumpur Hospital and Penang Hospital, you can easily just walk in or just call in to make an appointment. The cost and turnaround time depends on whether the test is performed in the Ministry of Health hospitals or commercial labs, right? And patient pay can be as little as 1,000 ringgit, and it will take probably around 2 to 3 weeks. Result.
All right, thank you, Doctor, for the explanation. And I understand that genetic counseling will be provided to the family of SMA patient. How important is it? And what are the challenges you have faced during your years of experience?
Well, genetic counseling, as you emphasize, is integral to the testing process. It assists in the decision-making process and hopefully in informed choices being made. Timing of genetic counseling and testing is crucial and is dependent on type of testing. So diagnostic genetic testing is to confirm diagnosis of SMA in a symptomatic individual. And this goes along with providing information about SMA in a sensitive manner and also psychosocial support to the family. Prenatal diagnostic testing can be offered to couples or both partners who are known carriers of SMA, which incur a 25% risk of the fetus being affected in every pregnancy. Carrier testing, however, may identify couples at increased risk of having a child with SMA, thus allowing informed reproductive choices. I think it was mentioned earlier that the carrier frequency is 180. So one could be a carrier of SMA even if no one in the family has SMA, and even if one already has children without SMA. That's important to know. And the other screening is not available in Malaysia. A newborn screening allows for an affected newborn to be diagnosed very early before irreversible damage. And evidence has shown and treatment leads to better outcomes. There are many challenges in providing genetic counseling for SMA. Cost of testing is one. Insurance, because genetic conditions will not be covered by insurance. And challenges when you are discussing with couples regarding reproductive options. Termination of pregnancy is one difficulty. And also pre-implantation genetic pregnancy.
All right, moving on, Doctor. As we know, SMA needs multidisciplinary care. Can you please share which team was involved and what about the treatment or drugs that is currently available and approved by the FDA?
So ideally, a transdisciplinary approach or collaboration between various disciplines can be made available actually to provide a more holistic whole of lifetime services from diagnosis to treatment, including rehabilitation and psychosocial support. Usually the role of care falls on the pediatric neurologist or genetics. Orthopedic care, occupational and physiotherapy help to optimize function and minimize impairment, prevent contractions and scoliosis. Speech and language therapy with the help of nutritionists, they have crucial role in addressing feeding and swallowing problems due to the vulvar dysfunction. The main cause of death in SMA is lung disease infection. Input from a dedicated team of respiratory specialists and therapists initiated early. The baseline pulmonary functions, the cough effectiveness, and the presence of sleep disordered breathing, so as to optimize the care for each patient. Psychological and mental health support can assist parents to go through each stage of the disease, from the shock and learning the diagnosis and prognosis, and oftentimes when dealing with overwhelming anxiety and stress from caring for their child, so as to prevent burnout. And then grief when life-sustaining treatment can prolong life and add to quality of life, but they also make it more difficult to predict end of life. Hence, palliative care and advanced care plans discussion are essential part of management. The current available FDA-approved drugs are actually not a cure. They're known as disease-modifying therapies. And they reduce mortality and improve the motor function for children with SMA. Nusinersen in Raza was approved in 2016. This was the first FDA-approved drug, followed by targeted dysfunctional SMN1 gene therapy, which was approved in 2019. to treat type 1 SMA under 2 years. And the last one is Risty Plum, which was approved just last year in August. Yeah.
All right, great, doctor. That will be amazing for the SMA patients. Thank you so much, doctor, for answering all of the questions. We hope everyone has a better understanding of this disease. And the fact of the day, as we all know, the carrier rate is 1 in 50 for SMA. And in Malaysia, we have 25 to 50 babies who are born with SMA every year. That was quite a high number, right? Okay. For the next session, I will hand over to Miss Sharus. Welcome, Shah. Over to you.
Thank you so much, Hazika. I am Sharus. I have Spinal Muscular Atrophy Type 3. I'm an interior designer and creative, moonlighting as your host this fine Saturday morning. Thank you, everybody, for being here. Remember, we're looking at the chat box to see if you have any other questions that you would like to ask us, and this will all go into the Q&A section later in this webinar. This will be more a conversational segment about living with SMA as someone who is afflicted by SMA and someone who cares for a child with SMA. It's a little same, but different. I would like to introduce Aina. She is an SMA type 2 young adult, a creative and all-around wonderful person. Hi, Aina. How's it going?
Hi. Hi,
Right, so
Charles.
how are you today?
I'm good. How are you?
I'm good. Awesome. Okay, I do have a few questions for you, and we're going to start immediately. How and when were you diagnosed with SMA?
So I was diagnosed through biopsy at the age of 2.5 years old when my parents started to realize that there was a delay in my milestone. That was about 23 years ago. So, and this year, April, I did genetic test in HKL just to know the detailed result of the SMA.
Cool. What treatments are you on right now, and how does that improve your condition?
How I wish I can get the treatment. One of my dreams is before I close my eyes, I wish I have the chance to get the treatment. No treatment for now, but I'm depending on medical support, such as BiPAP and cough assist. I started using cough assist since 2017. It helps me to clear my lung and I can cough easily. If I am not well, if I have flu or cough, I will do it twice a day just to clear my lung, and it makes me easier to throw out the phlegm. Then I don't need suction. I hate suction. You know how painful it is. For BiPAP, it started last year. I wake up in the morning, I feel slight headache. It didn't happen every day, but once a week. My latest sleep study results showed that I have developed mild hyperventilation. I do sleep study every 6 months. Because of the symptom, my respiratory doctor advised me to use BiPAP, and I use it every night during bedtime. Last but not least is the physiotherapy. We are lucky that WCJ has sponsored online physiotherapy for SMA patients, or else I have to go to PPUM for my physio and OT. I have weekly online physiotherapy session. It helps me a lot, especially with my scoliosis, neck control, upper and lower limb, and I also learned the proper breathing exercise technique.
Awesome. I completely agree with you on the importance of physiotherapy and just keeping yourself moving all the time. Which brings me to, as an adult, what are the barriers of living with SMA in Malaysia?
Okay, in terms of education, I was brought up with parents who are very strict in education. They took the challenge and sacrificed a lot to make sure that I get a good education. From my parents' experience, they told me that it is not easy for them to get a school for me, but they fought hard for it. Even in higher education, we have to survey a few colleges that provide facilities for disabled. Not just that, we also have to deal with the management, either they accept us or not. And that is the reason why my parents make sure that I get a good result in SPM, so that I can apply for scholarship. I am a Hong Leong Foundation and Sime Darby Scholars. We are lucky we managed to go through this, and here I am now. I graduated with graphic design, and I decided not to be employed. Why? Because I need assistance in my daily tasks. I cannot go to the office just like a normal person. I cannot sit up for too long due to my scholarship. I cannot cooperate longer working hours. I can easily get tired if I sit for too long. I also need assistance if I want to go to the washroom. For my case, I dare not to take any job if I don't think I can do it. I will always be transparent to my client. I will tell them my terms and conditions. Of course, my future plan is to grow the business. Hopefully, in a few years, I can hire assistants so that I can grow and expand my content.
Excellent work. It's something that we as people with disabilities think about all the time, especially when it comes to, do they have bathrooms that I can access? Very important. Anyway, with everything that you said, why do you think it's important to create awareness for SMA?
Because many of them do not know what is SMA. They need to know and understand the truth about SMA. What is the do's and don'ts of being SMA? Very simple, just like my case. At first glance, people thought that just, oh, Aina cannot walk. But they don't know that Aina cannot kick her leg. Aina cannot reach high things, cannot reach heavy things, cannot even hold a glass of water, cannot even shampoo my hair properly. Yeah, as simple as that, and the list can go on. That is why we have to create awareness.
Amen, sister. Right. That is all the questions I have directly to Aina. We will answer any of your questions towards her in the Q&A later. Thank you so much, Aina, for your time and super thoughtful answers. We will definitely go to Sugi now. She is the co-founder of WeCareJourney, has done so much for our little community alongside her husband, and is an amazing mother of Brendan, who has SMA type 1C. Sugi, how are you?
Hi, Charis. I'm good. Can you hear me?
Yes, perfect.
Great.
I hope everybody is still tuning in. We have some very interesting care-based questions for Suki right now. We're going to start with, how did you feel when they diagnosed your son with SMA?
Well, I will have to dial back 10 years ago. Brandon was diagnosed when he was 1 year old, just a month after he had celebrated his birthday on July 13th. I can still remember the date, which is August 15th, although it has been 10 years. I can still remember the scenario, how the doctor gave us the news. The way he gave the news, it was so, like, okay, I knew it. I suspect it was SMA. I mean, I understand that to the doctor, we are just one of the patient who happened to see him that day. But to us, Brandon is our world, everything to us. And he didn't make it better when he told us, well, SMA is just like, your child is 1 year old now. In 1 year's time, he has maybe 1 more year to live. So take him home and spend really good time with him. And right after that, our brain just shut. I could not remember anything else that he said. It was just like we were thrown into a cave. We couldn't see anything. All we could hear was the echo. And we went home and we contacted some friends who knew other genetic counselors in other hospitals. We were referred to PPUM. We were fortunate to see Prof. Tong, who gave us very good genetic counseling, like what Dr. Chung mentioned just now. I guess as parents, we need to have time to digest the news, although it will never be easy. But giving us time to really understand what it is matters.
I feel like that kind of laissez-faire attitude was very prevalent even when I was diagnosed as a child. And it seems that the chat agrees. What kind of challenges do you have as a carer of a child with SMA?
The challenges. It's funny, like how it's easier to share the kind of challenges now with everybody. So imagine now, everyone, how do you feel during this pandemic? This pandemic started last year in March. Our fear was tremendous. It's the same like for us. When the parents get the news, there's so much fear because there's so much unknown about it. But with that, we do wearing a mask, avoiding crowded places, and hygiene is what we practice every day, and it's in our life. I would call it pre-pandemic. You know, when Brandon wear a mask to school, it was like, oh my God, this child is sick. He's contagious, or maybe he's not well, or something like that. But mask is in everyone's life right now, isn't it? So we have been living it before the pandemic, where we actually are so afraid of being having infection. We're not only afraid of COVID-19, before that we were even afraid of a simple virus that can cause our child to cough and cause pneumonia, because pneumonia kills them, all right? And anyone who cough or sneeze in front of my child, I'll give him that killer stare. So the same thing like what you're feeling right now, but the biggest challenge is the cost of living with SMA and the mental health. So we did a report, Persatuan WeCareJourney did a report on living with SMA in Malaysia, which we'll launch next month. And the biggest challenge that the caregivers share is the worry that our child will not make it. What happens when I die? Who will take care of my child? And in this COVID situation, it's very apparent. We were so worried that either Edmund or I gets COVID. What happened to Brandon? Who will take care of my kids? So that is all highlighted. And not only that, with now there's no cure, same as COVID. There is treatment, there's only vaccination. But for us, treatment is like what Aina say, treatment, physiotherapy, respiratory therapy, and on compassionate use, some medical, certain treatment that's available worldwide is already now in Malaysia, but that's still not sufficient.
Okay. I like how you brought up a topic about education, learning. I now brought it up just now, and I also went through the whole rigmarole. But first of all, I would like to say, with mask on outside, it's really nice to see everybody here, especially the people who are not panelists who are on video right now. Hi, it's really nice seeing all your faces today. Without the mask on, that's kind of like can't see you smile. Suki, going back to the whole education system, how do you approach it? How difficult is it for Brandon?
I think this journey from the beginning, the first 2 years or 3 years, is really survival to, you know, really make sure that Brandon is healthy and he survives every year. And when he comes to the age of 5 years old, we knew that it's the time that we have to look for schools. So we knock on 5 schools like every other school. The principal would say, I'm sorry, ma'am, I'm sorry, sir. As much as we want to take him in, we can't. And well, we had to look for alternatives. We are very happy that we found English Champ, who actually gave Brandon the opportunity to attend early education with 7 or 8 of his friends. And that time he was having a feeding tube with him. But 1 week into school, he actually wanted me to remove his feeding tube so that he can eat on his own and be like everyone else. So that shows how important this social and friends is for him. And we are into homeschooling journey. We are glad that we have friends who support us with his education, and I'm glad he has got really, really good and passionate teachers who actually is guiding him.
Okay, you mentioned just now that when Brandon was diagnosed, both of you just immediately shut down because you didn't know what SMA is. What avenues did you go through to find out more about SMA, and how did you sort of figure out a way to circumnavigate the whole situation?
To be very honest, the searching was done a lot by admin. I think the men and the women will take different role. And I always emphasize that in this journey, husband and wife play very, very important role. I shut down and I concentrated on taking care of Brandon and Jaden. I didn't want to read anything else that the doctor told me. I did read a little bit, but I just couldn't go on. And Edmund, being a man, he could just focus, and he dialed into Cure SMA, Google, and he spent like 24/7. He gave me a pile of, the whole, he can look, this is SMA, let's read. I said, no, don't tell me anything. And he went on, and after some time, we actually contacted the pharma company on clinical trials. We went everywhere, but search up in Google, there's so much contact. At that time, there was no any association, no NGOs in Malaysia. But we found a family, and her name is Alicia. She was the first family we met. And the words from Alicia's mom really, really gave me hope. She just said that do your best and let God do the rest. Our child can do tremendous work, and Alicia is in Cambridge. I mean, she's graduated from Cambridge. She's now in London.
Thank you, Alicia. Due to time, we're going to skip to the next question. And I think this is really important from you, especially, to give to everybody else. From the perspective of a caregiver, what advice would you give to the audience?
As I know, just now I saw the poll. I think many of the audience here today are from the doctors and medical graduates, and even to others who are here today. Just ask questions. If you are a doctor or a future doctor, if you see a child who's hypotonia, ask, could this be SMA? If you see a child who's bright-eyed, alert, and showing other symptoms that's almost similar to SMA, ask yourself, could this child be having SMA? The second question is, ask yourself, what can I do better for not just the child, but for the family? Look at the child as a human, not as the condition. Thirdly, now imagine if your child is born with SMA, how would you like the doctor to treat your child and your family? That's all.
Thank you so much, Sydney, for your insight and candor, and very poignant question at the end. How would you respond, audience? How would you react to the doctor telling you your kid has SMA? We would like to invite back Dr. Chung and Aina back to the screen so that we can start with the Q&A quickfire round, because there are several questions that the audience have asked, and they are super interesting. How it works is we take questions from the chat box. The similar ones are combined. All the speakers except for admin will be speaking today. Can we have, thank you. And because of the time constraints, we're gonna stop doing the Q&A at 11:55. Some of you will not be able to ask your questions, but you can definitely ask it to us on our social media with hashtag SMA webinar. We'll get back to you as soon as possible. I hope the panel is ready, because I am. Yep. We will start with a question to anyone who would like to field. Does SMA affect adults? Dr. Chung?
Sorry, did you say SMA affect dogs?
How does SMA affect adults?
Adults,
yeah.
Yes, just now you have saw the video clip. You can have milder onset in adults. So and the other types, which when they can grow to an adulthood. So yes, and adults like Anna and Sharu, they are adults, right? So definitely, it's a neurodegenerative condition which goes on to adults.
Cool. I would like to add, you can definitely suddenly get SMA when you're 30 something. It's like the slower cousin of that ice bucket challenge thing. Anyway, we'll move on to the next question. How would you differentiate spinal muscular atrophy with cerebral palsy? And since the initial presentation is similar, I think Dr. Chung can take this.
Well, I've mentioned it looking out for those motor relations in SMA, such as the hypertonia, the absent reflexes, and tongue fasciculations, which are fairly typical. You look out for them. Cerebral palsy is not actually a diagnosis, and it usually affects the brain. So usually you have, and they have different types of cerebral palsy, the hypotonic type, the atonic type, chorioacetoid type. So they're fairly different.
Okay, this is more a question for Aina and Sugi. How do you explain the condition to other people or your other child or children? Sugi, please.
How do I explain to, let's start off with how I explained to Jaden. So when Brandon was diagnosed, Jaden was only 3 years old. So Brandon also has a cousin who is the same age. At that age, I think visual is very important. It's very crucial for him. So he saw the cousin sister was running and walking, and he started to ask me, how come Titi is still lying on the bed? Why can't he be like Kylie? We have to explain to him that Brandon is different. He's affected by his muscles is weak, and he will take time, and he needs a lot of physiotherapy. And as he grew and he saw his friends in school and all that, and then he'll ask me, when can Brandon join me in school? When can Brandon, why can't Brandon attend school? And so on and so forth, up until he was maybe 8 or 9 years old, when he started to be able to read and digest information in a simple manner. He now understand what his brother has. So for right now, Jaden totally understand what Brandon has and what the prognosis is. So I would encourage parents to speak to your child in the appropriate age with the appropriate answers. And I believe this is really needed with the support from the doctor, especially genetic counselors or the neurologists who is in, to guide the parents how to speak to the child. I had to ask friends in US, friends from everywhere, to say, how do you actually explain to your child? So reach out, for the parents who are here today, reach out to your doctors or to your friends so that you know how to explain to your other siblings. Aina, I leave it up to you on how you explain to the public.
Oh, okay, thank you, Sayu. All right. So my parents basically brief all the teachers, lecturers, and everyone about my condition. So I'm lucky that I'm surrounded by good and kind friends. They always make sure that one of them will always be with me. So everywhere I go, there will always be one person that stick with me. It will be different person every time. So yeah, I guess that is how I didn't explain actually. I just make them involved in my condition. I make them help me through like carrying the books, the laptop. That is how they learn how is SMA look alike.
Okay, thank you so much, both of you. The next question would be, I really like this question from chat. Thank you so much for asking this. I'm going to ask Aina because my answer to this would be being as charming as I can. Did you experience stigma from your peers and friends, and how did you overcome them?
No, so far no. They are all very good, very kind. They never look negatively. Yeah, I guess I'm lucky because my environment is very positive.
That's wonderful. I did not sort of have the most positive environments because children are mean, but generally, if you have a good bunch of people around you, they are super helpful, and being nice becomes a necessity more than a thing you just do. So I guess you could say most SMA people are super nice. Maybe. Anyway, moving on. What side effects What kind of treatment are there for SMA? Can you reiterate, Dr. Chung?
So the treatment that is available, the drugs, they are as disease modifying therapies where they can.
Sorry, Dr. Chung, you're really lagging right now.
Sorry?
You're super lagging right now because of the internet.
Lagging?
Yeah.
Oh, okay.
We'll get back to this question. I guess you can just do a hard reset on the internet, I guess. Otherwise, you can just post it on chat. Because we'll move on while that happens. Okay, this is a very interesting question. If SMA poses difficulty in breathing, feeding, and mobility, what kind of adaptation and modifications are needed for care and inclusion? I would like to ask you from a carer of a young child perspective, and Aina from mobility perspective as an adult. Starting with Sugi, please.
Sorry, Sharis, could you repeat the question again?
Sure. With the difficulty in breathing, feeding, and mobility, what kind of adaptations have you needed for care and inclusion?
Okay, so I'll share from the perspective of type 1. Basically, a type 1 child would probably need a BiPAP to help him to be, with his respiratory functions. Cough assist machine is tremendously helpful, where we help with the excretion of the phlegm, because SMA children, type 1 especially, they are not able to cough effectively. And suction machine is definitely a must. We have oximeters to monitor the SpO2. And what else do we have? Dr. Chen, do chip in if I miss out anything in terms of the medical equipment. So all these are really expensive. It can come out to 5 digits. The machine costs that much, and it's a really big burden for the family. Aina?
Okay.
Sharus, you're muted.
Sharus, you're muted.
I muted myself. My apologies. I know, what kind of mobility devices do you use, and what other modifications in the house, outside of the house, in the car, when you're going to work, etc., do you use for care and inclusion?
Yeah, at the house, I use a flying turtle. Basically, just like a turtle. So I sit on it to move around the house. It makes me easier. My mom will always put all the things at the ground floor so that it will make me easier to reach the things. And in terms of exercise, of course, I have always to do breathing exercise all the time. It's very important to do the physio and to keep me fit and maintain my muscle.
Okay. Unfortunately, that is all the time we have for Q&A. You can definitely reach us on our social media or with hashtag WCJ webinar, and we'll get back to you. I'm going to have a poll inserted for all of you to check out. Can we get the poll out, please? Yes. So this is just a second set of polls. Would you like to know more about SMA? Yes or no? What do you want to know in our next webinar? Medical information, patient and family stories, or both? And third, how would you like to contribute in the future? Oh, magic questions. Would you like to volunteer, share with others about SMA, or donate? I will be ending this poll in 5 seconds. 4, 3, 2, 1. Thank you so much for answering. Oh, okay. Definitely going to do more webinars, since a majority of you, 97%, wants to know more about SMA. And I am so glad so many of you want to help in the future. We look forward to seeing your faces once COVID blows over, and we'll have more wheelathons, etc. Right, moving on. So now that Q&A is done, I am excited to bring you a brain teaser to wake yourself up on this Saturday morning, because it is almost lunchtime and we don't want to keep you. It is called Kahoot. It is a quiz show. We have 10 questions, and it's based on everything we spoke about today. You can log in to kahoot.it, kahoot.it, with the number that we'll post. But most importantly, I would like you to put your name like this. So your name and the last 4 digits of your IC. Because if you're like me, I have a very common name. It's Aisha, shortened to Sha. So if you go to the mama and you yell Sha, 15 people will turn around. It's not a good feeling. While I reminisce about going to the mama for a while, please definitely go on Kahoot it and sign up. We'll be starting in 11. We'll be starting the whole questionnaire thing at 11:59. So remember, when you log in, the game pin or room number is 2798767. Log in at kahoot.it. Hi, was Mia, Jasmine, Adelina, all names, triple V. I don't know who you are, but cool. Ryan or Hazira, Lalita, Ryan, Loke, Elim, all of you people, so many people. "30 seconds to sign up before we start. Are you ready?" Just FYI, we do have prizes for the first, second, and third winner. Which, whoever wins, definitely contact us in the chat box and we'll get to you. TK, Tanisha, Sam, Vimal, Gad, Yen. 1 syllables. Nice. Right, we are gonna start now. Thank you everybody else who may not have managed to join. Let's go. Get to know SMA. Question 1, how many babies are estimated to be born with SMA in Malaysia in a year? Click on the triangle, diamond, circle, or square, whichever one you think is right. 10 to 20, 50 to 100, less than 10, 25 to 50. I don't remember, personally. Also, I can't join because that's like cheating. I have all the answers with me. TWC, you are winning. Question number 2, what causes SMA? Triangle, bacterial infection. Diamond, immunodeficiency. Circle, autoimmune. Square, gene mutation. Which one is it? You have 5 seconds. 3 seconds. 2, 1. TWC, still winning. Oh my God, guys. What is the type of SMA inheritance? Triangle, diamond, circle. 3 answers this time. Which one could it be? Is it sex-linked, autosomal recessive, autosomal dominant? TWC overtaken by Adelina. What is this? Question 4, how many types of SMA are there? 10, 4, 5, including type O, 2. Maybe one of these is a trick question. I don't know. Maybe I'm just doing this so that one of you skips. Oh, Mirza is now ahead of the pack, taking over from Adelina. Min, 2nd place. 5th question. SMA needs a multidisciplinary approach. All of these are included except respiratory, nephrology, orthopedics and rehab, and nutrition. Which one is it? Mirza, still at the top of the pack. Middle of the line, question 6. What is the first line investigation of SMA? You get a biopsy, electromyography, molecular genetic testing, or creatinine kinase level. I can't read. Still ahead of the pack. What a boss. Question 7. What is the gold standard investigation for SMA? Is it quantitative analysis of SMN1 and SMN2, creatinine kinase CK level, electromyography, EMG, MRI, and spine, brain and spine? The first one is triangle. Mirza, Min, Atika. So far for second and third. 8th question. These are currently approved treatments for SMA worldwide, except which one doesn't sound right? Zolgensma, Orencia, Spinraza, or Evrysdi? They all sound like salads. Question number 9. What SMA type 1 is also called? Dubowitz disease, Werning-Hoffman's disease, Kugelberg-Wieslander disease. Lucky last. Can the current available treatment cure SMA patients? Is it true or false? The podium is as follows. 3rd place, D344. Are you a durian? Because you sound tasty. Ryan, 673 something. Because the thing is lagging. Atika, you are the winner on this beautiful Saturday morning. Thank you so much for participating, everybody. This is done. We are at the end of this webinar. People who won, please message us on chat box. You can send us a message at office@wecarejourney.org as well to arrange the delivery of your prizes. Thank you everybody from Malaysia and overseas for being here on your Saturday morning and participating. This will be available for rewatch on the YouTube channel, Persatuan WeCareJourney, and Facebook group, same name. WeCareJourney is one word. We do have a feedback form that we would like to invite you all to fill out, especially if you have any comments, if there's not enough time, too much time, if there's too many things going on, if you would like it not to be on a Saturday morning for not morning people, I get it. Thank you so much for the speakers today for sharing their time with us. We would like to especially thank our webinar tech for today, Ranan. We'll have him on screen right now so everybody can say thank you and he can wave. Ranan, get over here, like in Mortal Kombat. Ranan, where are you?
Hello, thank you for attending today's webinar.
Yes.
Stay safe.
He sounds very excited. Anyway, again, thank you so much for your time. Any additional questions, catch us up on all our social media and hashtags. It's on the screen right now. We're going to leave this room open for another 5 minutes. So we're going to close it at 12:10 so that if you have any other questions, any feedback that you want to deliver right now, we will definitely talk to you. But thank you again so much for joining. Watch WeCareJourney Spaces to see if there's the next webinar, and we'll see you then. Thank you. Bye.
Bye.
Bye, and thank you, everybody. Stay safe and have a good weekend.
Thank you,
Bye,
everyone.
Sorry for the lag.
Thank you.
Have a good weekend.
Okay, take care.
There was a comment on the feedback form cannot be opened.
Oh, feedback form cannot be opened. We will rectify that ASAP.
So everyone else is still on the call. It's okay. You can hear. You can chip in if you want now.
This is like final chats.
Post webinar chat.
Post webinar fireside chat.
Yeah.
So we
that's right.
will send the
Fireside
feedback form through the email also.
chat. Good idea.
Feedback forms will be sent by email to you.
Yeah.
We're not sure when the next webinar is, but definitely check out the spaces on Facebook, Instagram, etc., and the website, of course.
If anyone wants to go off mute and just have a chat now, you can too. Right?
Yep, raise your hand if you wanna like talk,
chit chat,
and we will unmute you. You can claim a point. What kind of point would you like? Dot?
The CPD, right?
No,
CPD?
sorry.
Unfortunately, cannot.
Oh, it is not under CPD.
Future
points.
webinars. Future webinars. We'll keep you informed.
If anyone wants to say hello, you can just go off mute.
I've made it so that you can unmute yourself if you want to talk to us personally.
Hi, Edmund.
Hello.
This is Sydney. I just want to say hello.
Oh, hi, Sydney.
We can't hear you, Sydney.
Sydney, we couldn't hear you just now. Would you like to say it again?
I just would like to say hi, and it's really an awesome webinar.
Thank you. It's our first one.
Thank you.
Hopefully
Look
this gets
forward to
better.
more.
Yes.
Thank you. Yeah, we will be. We're. I think there's a number of good questions which we also didn't manage to answer. So we're going to look at how we can follow up with some of the topics.
I think what would be interesting is we can compile all the questions and do a Q&A sort of session and post it on YouTube or go on Twitch and do something with that so anybody can just join in or watch it later. There is no certificate for this current webinar.
I was wondering, would people want to go on Clubhouse? Would it be something fun to try?
Sorry?
Do you think people would like to get on Clubhouse? Do you think that'd be fun?
I will withhold comment on that because it's not my favorite platform.
Really? Why not?
I find it clunky. I'm a Discord person. Clubhouse is real clunky.
Okay. So Discord works the same, similar, isn't it? But just that you can't publish it.
I guess the main difference is with Clubhouse, at this point, everybody's downloaded it. So it's just easier to just get on Clubhouse. Oh, wow, super late.
But I admitted, what was it? Tan Wei Hyung, was it?
Something. Welcome to the end of the show. Oh, it's 12:11.
We're post webinar chit chat now.
Yeah, we're hanging out. It's nice. Hanging out is nice. It's 12:11. Up to you guys if you want to stay on and keep chatting. For people who have stuff to do.
I don't know. It's interesting. We've still got 29 people. Well, that includes us. So there's probably another 20 people.
I'm wondering if those 29 people are just, just leave their computers on and, make breakfast. Bacon and eggs and SMA.
Hi, who's that?
Awesome discussion. I got a lot of information. And then my personal thought is that the medical approach is quite descriptive, but I didn't see the social model approach that much in terms of discussion. So it's really very informative. I'm looking forward to the next session. Thank you.
Who's this on the left? Who was
Thank you
that?
so much for the feedback.
Lalita, yeah.
Your son's teacher.
Okay. Who?
Bye-bye.
Yeah, we actually plan to do that because this is just only 1 hour. So it's really hard to squeeze in, the medical part and the living. So it's just like a preliminary round to the future webinars. That's a good point.
Yeah, nice. Awesome work. Looking forward. All right.
Yes.
Bye-bye.
Bye. Thank you.
Bye.
Bye.
Thank you.
Bye.
Anybody else before we close this chat room down? Because we're going to.
5,
4,
3, 2, 1.
Bye-bye.
Bye.
See you later.
Have a good
Bye.
weekend.
Fun. Sharuz. Well done, Aina. Thank you. Oh, I guess the winner is Dr. Chung.
Yes. more than 100.
Dr. Chung, winnerist. She gets every week.
Good job.
Hey.
Good job, everyone.
Thank you. We need to tell Shamun what was our figure.
I know, this is so good. This is way beyond expectation.
No bad.
Also, we should probably leave this, open up a new one so we can do some,
Please.
some ending stuff.
Thank you. Bye.
Okay, bye.